All right, KNES 415, hey guys. I'm gonna go over the test, a general go over. As always, if you guys want to I can't, for academic integrity, I can't give you tests at home. But I'll be happy to FaceTime you and we can go over your specific tests like I've always offered. But I thought this might be a general good way to kind of go over some things with you guys. So I'm looking at my main screen and I'm looking at a student that made a 96. And I'm just going to go over every question and just, remind you on some things that I emphasize a lot. A muscle's function is based on the motion it is responsible for causing or creating. That is false. I say it over and over and over and over again. It's about the direction of pull. The bicep, which is an elbow flexor, but the bicep can be responsible for both flexion through concentric work or extension through eccentric work. So the bicep can be responsible for both motions. So it's not about the motion, it's about the direction of pull. Working through eccentric work, identify sagittal plane and transverse plane function of the left tensor fascial lata. So two things here that I warned you about. Who cares if I say the left? Your right-sided circles still tell you the same function, and you have the same function as the bicep on my right as my left. So the left side, like I've mentioned several times, is irrelevant to function. Okay, and of course the contraction is irrelevant to function. So hip flexor and hip internal rotator. The sagittal function is the flexion pull, and the internal rotator is the transverse plane pull. The soleus is deep, and the gastrocnemius is superficial. Remember the piggyback, right? What position would you want your knee and hip if optimally stretching the gracilis? You want your knee extended because the gracilis is a knee flexor, and you want your hip abducted because your gracilis is an adductor. Two functions of the left sartorius, hip flexor and knee flexor. I'm reviewing this, but this is all in your book. How many muscles are being stretched at the ankle joint furthest from the left? So he's in a dorsiflexed position, therefore he's stretching plantar flexors. 1, 2, 3, 4, 5, 6, 7 that I held you accountable for, so 7. Two functions of the left tibialis posterior. The left tibialis posterior is the same function as the right tibialis posterior. You think about where that sucker sits in your fence. It's posteromedial. So it's a plantar flexor at the ankle joint and an inverter at the subtalar joint. To stretch the vastus intermedius, it only functions at the knee. So all of the hip stuff doesn't matter, okay, because it's only a knee flexor. So we had two answers that had flexed the knee. But how do you know which one of those is best? One says flex the knee, extend the hip. The other says flex the knee, flex the hip. And the hip is irrelevant. So it would only be flex the knee. It doesn't do anything at the hip. Okay, this was the girl doing the side lunge, and she would be stretching her left hip subductor magnus. I'm sure most of you got that one right. Okay, this is the leg extensor machine, commonly called leg extension. You know why I don't like that if you pay attention in 310 especially. Rectus femoris through eccentric work. If you observe knee flexion, so she's working her extensors, vastus medialis, lateralis, intermedius rectus, and you observe flexion, so rectus femoris would be one of those through eccentric work. Holding his left leg in the air, this is the guy in the green shirt doing some straight leg raises for his inner thigh. Holding his left leg in the air, how many major muscles as given in class would be working at the left hip? You figured out he needs to be working his adductor muscles, and I gave you 5 of those. Okay, this was one of the more challenging ones. So remember, fan-shaped muscles are we have special verbiage for fan-shaped muscles. Your pec is a fan-shaped muscle, and I'm not lecturing about the pec yet, but you know this from probably life, that we have an upper pec, and there's certain things that the upper pec can do that the other fibers can't, right? So with fan-shaped muscles, there's going to be something that all the fibers of the fan can do, and then there's other parts that all the fibers cannot do. So when I say gluteus medius and minimus, and I leave it like that, it's like saying biceps femoris. I'm inferring all of the heads. When I say gluteus medius and minimus, I'm inferring all of the fibers. When I say pectoralis major, I'm inferring all the fibers. So another way to look at this question, as specifically communicated via class lecture, the only function of all of the fibers. What direction of pull does all of the fibers have in common? Abduction pull. Only the anterior fibers pull in the direction of internal rotation. These guys don't. Okay. So as specifically communicated via class lecture, the only function of the gluteus medius is as a hip abductor. Yeah, that's true, because that's the only thing that all of the fibers do. There's 2 functions of the anterior fibers, out and across, but all of the fibers only pull out. Identify which of the following statements is true. This is the seated calf raise, where the lady is on the seated calf raise and she's smiling naturally for the photo. And the answer is gastrocnemius is shortened. It's on slack. Gastrocnemius is shortened at the knee, thus decreasing its contribution as an ankle plantar flexor. Something's got to take up that slack for the same work. Okay. This next one is the glute ham raise, where the guy is kneeling on the Roman chair and he lowers himself down. 310 taught you that we're working our knee flexors in this exercise. And from left to right, if I'm going down, I know I'm using eccentric contraction. So the gastrocnemius is a knee flexor through eccentric work. 2 functions of the left piriformis, hip abductor and external rotator. Which muscle of the knee unlocks the knee from anatomical position? Popliteus. Working through eccentric contraction, identify 2 functions of the left rectus. Again, left, right has the same function. Eccentric, concentric, isometric rest, same function, pulls. Hip flexor, knee extensor. Working through eccentric contraction, 2 functions. Tibialis anterior, what does the tibialis anterior do? Ankle joint dorsiflexor, subtalar joint inverter. Okay, so this question right here, if you got this one right, then by logic you should have gotten the gluteus medius right. As taught in class lecture, the biceps femoris is a hip extensor. So when I say biceps femoris, that infers both heads, and the only thing both heads do is a knee flexor. The long head is a hip extensor. Same logic. What would be the best way to stretch the peroneus longus? Well, what does the peroneus longus do? It crosses in the back, plantar flexor, crosses laterally, everter. So I want to dorsiflex and invert. Okay. This is the TheraBand. So the TheraBand is pulling in a direction of subtalar joint inversion. So the question is, you observe right subtalar joint eversion. So if the band is trying to invert me and I observe eversion, I'm going to be using an everter such as the extensor digitorum longus, and I'm going to be doing it through concentric work. Okay. 2 functions of the left biceps femoris. when the knee is flexed, knee flexor and external rotator. Remember, the biceps femoris is a lateral or external rotator. Okay, this is the girl doing straight leg raises, and she starts with her leg down and then she abducts it with gravity, trying to adduct her. So gluteus minimus through concentric work to get it up in the air. Okay. This is the Roman chair, and the girl goes from here to there. Posterior pelvic girdle rotation, but as we know, those are hip extensors because she's causing the hip extension to happen. Her body goes up, gluteus maximus through concentric work. Identify the hip rotator that would contribute to crossing your legs. So when you cross your leg one over the other, that motion is hip external rotation, and you got all this mass on the inside that's trying to bring you back. So you have to use concentric work to make yourself externally rotate. So identify one of the external rotators. Quadratus femoris is an external rotator, and you got to do it through concentric work. Okay? So again, a general review of the test questions. If you want to follow up, we can go over your specific answers, and I can clarify anything you need. Reminder, guys, I've said this before, but I'll keep saying it again. The reason I tell you guys open book, open notes is because I can't police it. I can't say no book, no notes. But honestly, you should be able to take this test or all of my tests without notes or without your book. It should be here. The applied knowledge should be here. So I just want to say, if you are, I'm not saying you are, but if you're going into my tests, like maybe you go into other tests, like, well, all the information is in there, I just got to find it. So I watch the lectures maybe in and out, but I just have all the information. So for the test, I'll just find what I need. I'm just saying. So maybe less dependence on notes and more dependence on applied knowledge. Okay. All right. I hope everybody's doing well. And don't forget, I've already posted wrist. I've already posted elbow radiulna. And next lecture, I'm going to start up here. Okay? Be well, guys.